So hear me out. I know I'm just a physical therapist, but I feel like we can add some value to the decision making if you're going to have surgery or not, or things you should consider before having surgery. Take it for example, when you go to buy a car. Like, would you rather talk to the salesman that's trying to sell you the car or the mechanic that actually fixes the car and sees how often it's in the shop and what needs to be done to maintain it? And I would consider myself the person you should be talking to before surgery if you're considering having back surgery. So there are definitely situations that you need surgery, but in most people, the decision to have surgery is kind of gray. It's really important to make the right decision because you can't go back. But there isn't a clear-cut reason to have surgery. Now, I'm going to go over 5 things that you absolutely should be considering, but the actual decision to have surgery is kind of gray. So what I want to do with you is share what I've learned over the past 10 years of working with patients who've had surgery and who haven't had surgery, and what's the research say, and try to find this area of compromise of you're making the right decision because you're checking these boxes, but also you have confidence in your next step. So hopefully these reasons and these different things that I'm going to talk about give you some confidence in your next step forward. Now, at the end of the video, I'm going to be going over things. If you're like, hey, I'm going to have surgery, what are some things and tips and tricks that I need to be doing to set myself up for success? I'm going to be going over that at the very end of the video, and that's going to be really valuable. But before we do that, let's go over the top 5 reasons why I see people have surgery and things that you definitely want to be considering before you have surgery. So having surgery or not having surgery is a complex decision, and hopefully with this video you feel confident in that next step because you can't go back. When I work with my patients, they often have these 3 circles of influence. So in the middle is their decision, right? So they're going to make their own decision, and that's going to be the final say. But these circles of influence are what they read online, Google, when you Google your symptoms and the types of surgeries that you may have, your own history and what other people are saying about that surgery or their back pain or their journey, and then also the influence of your physician or your physical therapist or whoever you're talking to as a medical provider to help you make an informed decision. And all 3 of those things kind of come together to make sure and help you make that final decision regarding surgery, like what type of surgery and what the expectations should be after surgery. And let me tell you this, when people first have back pain, they don't start back pain like with the thoughts and feelings like, I'm going to have surgery to fix this. Most of the time, almost every single time, people go into back pain thinking, hey, I'm not going to have surgery no matter what. Like, that is not going to be my path. That is not going to be my outcome. I'm going to do everything I can to avoid surgery, which is great. I think it's a good mindset because like that's the end of the road and you don't want to have that intervention without some serious consideration. But that being said, like as time goes on and lack of progress and the persistence of pain and the lack of ability to do things, the surgical intervention or surgery becomes more of an okay decision, more of a realistic decision. And that's where hopefully these things that I go over today help you make that next best decision, because surgery is serious. It's not something that should be taken lightly. It's not something we usually consider in the very beginning. But eventually we make our way there and it becomes more of a realistic goal for us or a realistic outcome. And these 5 things I'm going to go over today are going to help you give you some confidence and make sure that you're making the right decision. So let's go over the 5 things that you should be considering or things that can tell you if you're going to do well with surgery or not. So as a side note, before we get started, trust me, we're going to go over the things really, really quick. But I want to tell you the goal of the surgery. The goal of the surgery isn't necessarily for back pain relief. Let me say that again. With surgery, their idea of a positive outcome isn't necessarily removing your pain completely. The primary goal of surgery is to protect the spinal cord. When you start to have nerve changes or weakness in the leg, that's a sign that the nerve is being compromised. And the goal of that surgeon is saying, hey, I need to protect your nerves because everything else will fall into place after that. If you have nerve damage or nerve impairment, that is the goal of the surgery. The secondary goal of the surgery is to reduce your pain and improve your function. So remember, it is protect the spinal cord, then improve pain, and then improve function. So it's kind of in that order. People go into surgery sometimes thinking it's for their pain, but it's actually to protect your spinal cord. Now, let's go over the very first reason and one of the more common reasons that people have surgery, and it's called a listhesis or a spondylolisthesis, is that the slippage of the vertebrae. When I'm looking at the spine here, this bottom vertebrae, most commonly L5-S1, it starts to slip forward and starts to impinge on the area of the spinal cord. And so it's often done in grades, and you'll see it on your MRI or X-ray, and it'll say a spondylolisthesis or a slipping forward of that vertebrae, and it starts to be in the space it's not supposed to be in. So when you start to have higher grades of spondylolisthesis or listhesis, or the slipping of the vertebrae moving forward, grade 4s and grade 5s, they start to consider surgeries such as fusions, because they want to provide some stability in that area. So if you've had an MRI or an X-ray that showed slippage of that vertebrae and you're having leg symptoms, it may be worthwhile considering the surgery. And I've seen patients have surgery because of that. I've also had patients that go in expecting a minimally invasive decompression surgery, but they have a high-grade spondylolisthesis or a slippage, and they end up needing a fusion instead of a compression or decompression, and they're a little bit confused why. Well, that's why. Remember, the primary goal of the surgery is to protect the spinal cord. If you're having a bone slip into the area of the spinal cord, that is something to be cautious about, and that's called a listhesis or the slippage, and you'll see that in different grades. So that's a common reason that people need surgery. So another more common reason, and the second reason that people may have surgery, is progressive nerve loss. And so this is a little nerve loss, progressive weakness due to nerve impairment. So progressive neurological changes. This one's a little hard to measure on your own, but I'm going to show you here how you do that really quickly. But before I do that, I want to tell you that is related to bowel or bladder changes. If you feel like that's you, you would know that was you. Like, that is something that is very apparent, and that is a warranting surgery pretty quickly. But that also would be weakness in the foot or the big toe. That would also be reflex changes. That would also be sensation changes down the leg. And that is saying if you have that and it's getting worse, that's progressive neurological loss. Now, I just talked about the instability, and right now I'm talking about progressive neurological loss. I will tell you, with these 5 things that I'm going over, it's not just one of those that will determine if you need surgery or not. It's usually a collection of those. If you have more than one or multiple of them, that just makes the decision even more clear. If you only have one, then it makes it a little bit more gray. But the progressive neurological loss is something that should be taken seriously. When I do my clinical exam, I'm testing reflexes, I'm testing strength, because we want to make sure if you have some of that weakness, you are improving over time. If you are not improving over time, that's just another reason that you may consider surgery. So this is a way that I work with my patients to find out if they have progressive neurological loss, is that I do the heel-toe walking. And so what I would expect in a normal response is able to heel-toe walk a little bit. Remember, it's not a balance test, right? So you can hold on to whatever you need to. So I'm walking on my heels, then I'll have them start over and walk on their toes. So this would be a normal response, and if you have progressive neurological loss, it would look like this. So when I go to walk on my toes, you just can't. Like that collapses, that calf collapses. Or when you go to walk on your heels, you have foot drop. So it would be like boonk, and I couldn't maintain it. Boonk, that would be the foot drop. If you have progressive loss in strength in your legs due to a nerve compression in your back, it would look like one of those things, and we would pick it up quickly on the exam. But sometimes it's hard to notice on your own. And so big thing that people tell me is that they say, hey, I've been catching my foot when I'm walking at home way more than I used to, and I'm losing my balance. Because when they go to step, they catch it because they can't do that heel-toe walk. So that may be something that you want to look at, but your PT or physician should definitely look at this if they're considering if you have nerve loss or not. So the third reason here that people would consider having surgery is just lack of improvement. When you're looking at 8 to 12 weeks and you seriously have not made any improvement, that's a good reason to consider surgery. Like, what you're doing isn't working, your body's natural healing process isn't working. When I work with clients, we measure them on day 1, their strength, their pain, their ability to bend over, and then we remeasure it as we go. And that's why there's some value of working with somebody throughout this process, because sometimes when you're in it and you're having pain every day and you're having tingling down the leg and whatever else you're feeling, it can be hard to determine progress because you're in it every day. Like, you're too close to it to see the improvement. I have had many patients that they're like, hey, I haven't made any improvement. And I'm like, okay, like, you feel that way, but the things that I have measured along the way are improving. And while the improvement may not be as fast as you would like, you're still improving. And so I think it's important to have somebody on your side that can check that in progress as well as what you feel. And so if you're a part of that 1% that hasn't had any improvement in 8 to 12 weeks, then it's worth considering moving the next step towards surgery, more, another image or an injection or a surgical consult, because your body just needs that little extra boost. But most of the research says, before that 8 to 12 weeks, if you've had some sort of progress, then you need to consider just staying on that pathway, even though, you may not like being patient for that long or may not like the quickness of your recovery, but it is what it is. Like, some people's bodies just take a little bit longer, especially if you have a lot of comorbidities such as your weight or diabetes or cholesterol, hypertension. When you start compounding those things, your healing time frame may extend. And so when I'm working with my clients, I'm like, hey, it's 12 weeks in, you haven't made any improvement. I think your next step is this. that is a kind of an okay spot to be because you know you've tried everything beforehand, but also at the 8 to 12 weeks, we have a conversation of being like, hey, I know it's slow, but you are improving, so I would stick on this pathway. So that's the third most common reason is, you know, if you're considering surgery, you may be more appropriate for surgery if you've had zero improvement. If you're curious of what you should be doing to help yourself along that 8 to 12 weeks remarks, you can 8 to 12 week or so, you can absolutely team up with a professional, but I have some resources on my website that you may find useful, including this YouTube channel, but also I have some PDFs that you could potentially purchase, or just there's a lot of free ones on there too that you could just download and give yourself that little boost that you're looking for. I'll put the link to that underneath the video description. Okay, the fourth most common reason of having surgery or considering surgery is you're just stuck in this weird spot. You're too young to have, let's say, a fusion, but you're kind of in that weird spot of like you're not too old, you're not too young, you've got a good future ahead of you with grandkids and the lifestyle that you want, but you're having this persistent pain. Let's say you have some changes on your images, you're having some numbness and tingling, you can't do much. You've made some progress, you're not unhappy with your progress, but you're also not super happy with it. You're in this weird limbo of like, okay, I'm young enough now that if I had surgery, I'm going to bounce back quickly. But if I wait 5 years or so, I may be too old and my recovery process may be longer. And I don't know if I'm willing to wait that 5 years. And this is where the grayness comes in, right? And we need to consider the entire person, not if you're just only checking one of these boxes, but what are you feeling now? What's your goals in the future? Have you tried everything? Are you happy with your progress? Are you wanting the surgery? And so in this area, I typically recommend that patients, if you're considering surgery, is to schedule it out 6 to 8 weeks from now, the consult with the surgeon. In that time, you're working hard, seeing your progress, you have that consult, and the surgeon is going to give you some answers to your questions. They're going to say, hey, keep on that path, or let's schedule a diagnostic injection, or whatever that may be. But you're in this weird spot, and that's why it's so important to team up with other people, because they can help provide some color in this area of gray in this decision making. And so if that sounds like you, and that's absolutely been the case for some of my patients, and they've went either direction. They're like, I'm okay with this progress, or I'm not okay with this progress, but it's an area of gray, and that's hard to measure in the research. And when I'm working with patients, you know, it's not their first idea to have surgery, but sometimes I'm like, hey, like, you may consider this because I'm not unhappy with your progress, but the future may be a little cloudy just because you have multiple things going on. And so I'm just always transparent. And so just do a good self-reflection if you're in that moment of like, okay, if I have this surgery now, I'm strong enough to recover from it. But if I wait 5 or 7, 10 years, I may not be as strong as I am today. And I really just don't want to have that limitation over that time. And so it's an area of gray. There is no black and white decision. But that may be like you, that area of gray is just something that you have to accept, but you're just stuck in a weird spot. Okay, this last reason is the 1%. And if you've had surgery, because of one of these reasons, you probably had it pretty quickly. And this reason is due to cancer, malignancy, tumor, something in your spine, or an infection, or something in your spine that is putting pressure on the nerve and back that should not be there 100% of the time. There is no area of gray around this. It is absolutely true that you need surgery. If you fell and broke somewhere in your back and you need some pins and rods, that is what it is. Like, you're not going to recover from that conservatively. I've had patients discover they have, the spine is one of the most common areas to metastasize to in cancer. They start to have nerve compression. They don't know why. They do an image. It shows a tumor. You need to get that tumor removed in the back fixed. So that 1% of people just is what it is. That most likely isn't you. It's the 1% of 1%, right? So, if you have back pain, the 1% of those of back pain have something in their back that absolutely warrants having a surgery. If that has been you, I'm so sorry. And we're going to be going over some things that, in other videos that you can kind of look at that. But I think it's just important to know if you're that part of that 1%, it is what it is. People are making the decisions in your best interest, but you need to get that stuff fixed. Okay, so now that we've gone over 5 reasons to have surgery, let me go over a real patient example that I had of somebody that ended up having surgery, but their pathway to get there. So I'm treating this gentleman. He's had 3 surgeries already in his back, so he's definitely not interested in having another surgery, but he started having pain down his right leg. Think of his right leg, no, left leg. And so he started having pain down the leg, and he noticed his leg was getting a little weaker. So he called me up. He said, Michael, I'm having another exacerbation. Can you come take a look at me? We did. And so I went there, but then I noticed like his strength wasn't there. He had some more numbness and tingling. So we did our best. We did 6 weeks of care. We did 6 visits over that 6 weeks, and he had made 0 improvement. So he had an MRI, and on that MRI, it showed lots of involvement in his back because of his past surgeries. But in that new area, which was the lower lumbar spine, L4, L5, L5S1, he had more nerve compression and more impingement on the nerve root, which is causing symptoms down the leg. Not only was it causing numbness and tingling, but it was causing weakness. Remember, that's another check as well. So he didn't improve in 6 to 8 weeks. Or 6 to 8 visits over the 12 weeks. He's had a progressive neurological loss down the leg. Then he had a surgical consult. In that surgical consult, they said, hey, you're having these changes. Let's not jump to surgery right away, but let's do a diagnostic injection where they did an epidural to the spine to see if that would give him any relief. And absolutely, I was there for the epidural. We watched it happen. He stood up from the table and had instant relief. He had almost 99% to 100% improvement in the nerve pain in his leg. Now remember, not to improve back pain, right? You're talking about nerves. He still had back pain, but he had 100% improvement in his nerve pain going down his leg. So not only was he not having progress, but he had a diagnostic injection because of that lack of progress, and he had immediate relief in his leg. And so then we started thinking, okay, we know exactly where we're working. We've tried our best, and he ended up having a lower level laminectomy or decompression, which is a minimally invasive procedure where they removed a little bit of bone in his back. He had that surgery, and day 1 after surgery, he had 75% improvement in his pain down the leg. He still had back pain, and we still had to work through that, but after, I think it was like 2 or 3 months of working together and improving the back pain, and because he had that bone removed in his back, he no longer had nerve compression going down the leg, and so he ended up with a little bit of mild back discomfort, but with some nerve glides and other treatments, we were able to improve him along the way and ensure that he got the outcome that he was looking for. So that was just an example, a very quick example of some of the decision making that went into his specific case to figure out if he needed surgery or not. He was okay with having the surgery because we kind of proved to him that he would do well with surgery. And sometimes that's what the treatment is about. Like, hey, we see people like you do well with surgery when they check these boxes. And some of those boxes are what we talked today. And so I think it's worth considering the individual situation, but also sometimes it is what it is. Like, you just have to make the next decision in your spine's best interest, even though you may not agree with it. Now, I want to go over something that I think is really interesting here in just a second. But what would surgeons say if you asked them if they had to have surgery because of back pain? It's very interesting. So here's the fun fact. They polled orthopedic surgeons and asked them, hey, would you have your own surgery if you needed it? So they're asking them, hey, if you had back pain and leg pain and nerve stuff going on, would you have your own surgery? Well, guess what they said? Guess the percentage of spine surgeons would have surgery if they needed it? It's 75%. 75% of the surgeons said, hey, I would have surgery if I needed it, only if my pain was a 7, 8, or 9, or 10, and I could not function. So they're talking severe pain and their activity is very limited. Then they would have surgery. What I thought was really interesting in that study is that 25% of surgeons would never have the surgery that they do. 25%. If you're talking to a PT, I think most of us would say, hey, I would do some PT if I absolutely needed it. I would say 25%, way less than 25% of us would say they would absolutely never have PT. So, but, PT is a lot less invasive, and I get it, it's less risky, but just understand, like, I think it's just really interesting that these surgeons would definitely not have surgery if they had pain. So it is what it is. I thought it was an interesting study, and let me know what you think if you had any questions regarding that. So now I want to go over the tips that I would be doing if I was having surgery tomorrow, the things that I would do to get ready for that. So here's the 3 things that I would absolutely do if I was having surgery. 1 is I would schedule PT now, start being PT, and I know I'm biased, but hear me out. Schedule PT, start PT, have PT up to surgery, and then have your PT visit scheduled before you have surgery, your first one. I do that all the time with my patients when I'm helping them kind of go through this pathway, and people in my membership program, I'm like, hey, here's your PT visits now. This is what you're going to be doing before. This is what you're going to be doing day 1 to set those expectations. Yes, you can go to any PT you want. Yes, most of the time you don't need a referral. There's nothing special about that orthopedic or that physician's PT. Trust me, I wish I could tell you there's amazing PTs that have this very specific training when they work with physicians. No, go to the PT you want, whether that's one that you've worked with in the past or one that's close to your house. Every PT is going to be able to help you. Just do what your gut says and follow your gut, because you're going to have the best outcome there. So that's the first thing that I would do if I was considering surgery and having surgery tomorrow myself. So I would be scheduling that PT and working with the PT. Now the next thing I would be doing is I would be working on my strength, mobility, and flexibility right up to surgery, and then know I'm going to be doing that after. We need to build some resiliency before. Now the way you do it and how you do it is very dependent on what you're feeling and the symptoms you're having, but you need to build some resiliency and make your spine a little bit more robust before you have surgery. You know that you're going to be putting in work afterwards, but just prime yourself before. It makes sense intuitively, and people never say like, hey, oh man, my recovery was worse because I was stronger. Like, that's just not a thing. Like, you want to do as much as you can before, whether that's working one-on-one with PT, or you're doing some of the exercise videos that I have, or you're downloading some of those PDFs that I have, but you're doing something to improve your mobility and flexibility as much as you can, despite the symptoms you have going on. So that is absolutely the second thing that I would be doing if I was having surgery. And then the third thing would be, you know, that patient example I just mentioned where they had the diagnostic injection in their back, I would do that exact same thing. I want to make sure they know where they're at and they know what they're working on. So I would have either an analgesic or a pain reliever injected in my back to see if that gave me any relief. If it did, okay, I'm confident they know what they're doing and they know the right area. If it didn't, then there may be some more exploring going on. So it would just boost my confidence despite the little risk there. And so I would be doing that if I was requiring surgery. So today we talked about a ton of things, of, you know, things that you should be considering if you're going to have surgery or not, the things that may set you up for success. If you're checking those boxes, then it may tell you like, hey, you may be leaning more towards surgery. Some quick facts about surgeons and what they would do if they needed surgery or not, or if they would consider it. And then some things that you should be considering if the surgical intervention is your next step. So we talked about a lot today. If you guys have any questions, please put it underneath the video. I think it's important to go into your next step or your next part of your journey with some confidence. So I will get to those questions and I will answer those for you. But as always, guys, stay healthy, keep moving, and take care of yourself.